status, they have higher rate of breast cancer. So therefore, the breast cancer in African American women are more serious. And they have more advanced stage of breast cancer when they are diagnosed. And one of the biggest contributing factors is access to health care. And this access to health care has to do a lot with the black women, I'll use the term interchangeable, socioeconomic status. Breast cancer is not detected early in African American women. And also, there are disparities in treatment because due to the time when the disease is detected. Are you guys following me? Yes. Okay. Now, research, it shows that individuals who have low socioeconomic status have a high incidence of cancer rates than those with a higher socioeconomic status. Does that make sense? And when we think about the socioeconomic factors that contribute to breast cancer, we're looking at poverty. Poverty is a big one. Then we look at access to health care. There are some communication barriers that can contribute to breast cancer being detected or even receiving care. I believe that women have to make a choice, and when they have to choose between caring for their children, feeding the children, we at times put our own health on the back burner. You know what, I gotta feed the kids, I have to pay the mortgage, I gotta take care of the kids, I can't do me right now. I'll have to put my health on the back burner. So even though I think something may be going on in my body, I can't deal with it right now. I just can't deal with it right now. So again, it's important for us to understand that breast cancer is a combination of factors that can lead to a woman developing breast cancer, and that's not saying you're going to make excuses for yourself. You have to just look at the entire picture. In addition to poverty, a person's level of education is going to affect their health status. The higher a person's education is, the greater they're going to be able to pull themselves out of poverty. If in their testing they determine that they have this triple negative based on those criteria, then that type of cancer will require a more aggressive type of treatment as compared to those type of cancers where they have the BRCA1 and BRCA2 genetic mutation. So these are just lingo. If you hear someone saying, you know, the triple negative, it just means that this type of cancer will require a more aggressive type of treatment because of those characteristics that's up on the slide. Let's talk about breast cancer. What are the signs and symptoms of breast cancer? Again, tenderness in the nipple. If you feel any type of lump, if you feel any type of nodule underneath your arm, a change in the texture of the skin. Sometimes people talk about the texture of the breast feeling like an orange type texture that's kind of a little rough. So any lump or tenderness should be reported to the healthcare provider so that you can get checked to see if it is breast cancer or not. And a lot of times, especially African American women, we have fibrotic breasts. Our breasts are very fibrous, so you may at times feel lumps. So that's why you need to get to know your breast. Get to know your breast, ladies, so that if you feel anything out of the abnormal, that warrants seeking medical attention. Also, we need to look at our nipples to see if there's a change in the nipple, the appearance of the nipple, any redness, any swelling. Look at the breast to see if they're symmetrical. Normally, women will tend to have one breast that's a little bit larger than the other. But if you see a change where now that larger breast is even extremely more larger, then that could be a sign that you need to be checked. Or looking at your nipple to see if the nipples are inverted. And again, any redness around the nipples, any swelling needs to be investigated. There are different types of breast cancer. As you look at the slide, the picture up there, the most common type of breast cancer occurs in the ducts of the breast. And they call that ductal carcinoma. About 7 to 10 women are going to develop this type of breast cancer. And then the second most common type of breast cancer occurs in the lobes of the breast. Some women will even develop both types of breast cancer. All right. There's another type of breast cancer called inflammatory breast cancer, and that occurs, it's kind of rare. In about 1 out of every 100 women can develop that. And as you can see, the breast is red, is swollen, and unfortunately, when this type of breast cancer is diagnosed, it's usually in a late stage. So again, women, get to know your breast, please. And again, that's another picture with the inflammatory breast cancer and what the breast tissues look like. Breast cancer is staged. There are different stages of breast cancer. And a 2-centimeter tumor is about the size of a peanut, and a tumor that's 5 centimeters about the size of a lime. And Joan, my secretary, wonderful Joan, has a beaded necklace, and on the necklace are the different sizes of the nodular breast cancer. So we have show and tell, so we're going to pass it around so you guys can look at that. Now these stages of breast cancer also have sub-stages. So I'm just giving you guys like a basic overall on the stage. If you hear someone that has a stage 1 breast cancer, that tumor is about 2 centimeters. So it's very small, and it really has not spread anywhere. It's good to catch the tumor in the early stage. Stage 1 tumors are wonderful to catch, because the healthcare provider can treat it, and you go on and live a normal, healthy, happy life. Stage 2 cancer now is a little bit bigger, maybe about 2 to 5 centimeters, and the cancer has spread to the lymph node. So you'll hear even on TV where they'll do mastectomy, and then they'll have to remove some of the lymph node. So that cancer, stage 2, has spread to the lymph node. A stage 3 cancer can be any size. The breast could be swollen. The cancer, again, spreads to the lymph node. Stage 3, we really start looking at the bad. No, it's really bad now. Stage 3, we think about prognosis. And of course, a stage 4 cancer, not only could be large, it could be any size, but it can spread to your lungs, your bones, your brains, and that's a type of cancer. When it spreads to your bone, your brain, your lung, you'll hear them say that the cancer has metastasized. And that's the time they want to tell you need to get hospice treatment. I was talking to a doctor here, and because the cancer is metastasized, and then chances of a meaningful recovery are slim. And again, that's just a picture showing you how the cancer could spread and the organs that the cancer could spread to. How is breast cancer diagnosed? Mammograms. In addition to mammograms, women can always request from their healthcare provider to have an ultrasound. So you can have an ultrasound and a mammogram of your breast. And most insurance now will cover the ultrasound and the mammogram. Also, like they can do a biopsy, they can do a CAT scan, and other types of diagnostic procedures, an MRI. But in terms of early detection, we're looking at the mammogram and the ultrasound. Some women, like I mentioned earlier, will have a mastectomy if they are genetically inclined to breast cancer. Sometimes the healthcare provider will recommend a lumpectomy. After that, we may get chemotherapy or radiation therapy, and also types of hormonal therapy. The prognosis of breast cancer depends on the treatment. And now treatments are really causing, the treatments have been so improved that women are living longer. And again, so the earlier the cancer is caught, the better the chance of that 5-year survival rate for women. So again, like the video stated, the overall 5-year relative survival rate for breast cancer among African American women is 78% as compared to white women. So you see that African American women are still lagging behind because again, later stage diagnosis, more aggressive types of tumor, therefore we're dying, we are not living, we're not making that 5-year survival mark. So, an area where we can make some money is think about designing a mammography machine that's more conducive to the woman's health. Maybe you can just walk in, get scanned, and walk out. Not take your breasts, put it on a pancake, and press them. So, you know what? It is painful. It's not a fun thing. I don't like going to have a mammogram done, but you know, it's something that we need to do because that's the only way we can promote early detection and increase our 5-year survival rate if we should ever be diagnosed with breast cancer. Finally, this is a quote that I found from Dr. Martin Luther King. If you lose hope, somehow you will lose the vitality that keeps life moving. You lose the courage to be that quality that helps you go on in spite of it all. And so today, I still have a dream. Yes, the odds may seem terrible, the whole socioeconomic issues and the barriers and the social issues with the weight and the nutrition and the diet and black women being single parents and head of household and us just being women in general having stress and being part of the workforce. But you know what? We still have to just take a minute, let's breathe, let's take care of ourselves. We only have one life to live. Amen.
My name is Tamika Pottinger. I'm one of the vice presidents of Pansy's Garden Breast Cancer Foundation. And I wanted to take this time to say happy birthday to Pansy Joyce Dennett. She is the reason that we founded this foundation. Pansy was born on March 6, 1944, and she passed on March 27, 2007. And I have a poem that I wanted to read. Today is your birthday. We celebrate you. We celebrate your Earth Day on this 6th day of March. We honor you by teaching women to honor themselves, to remember to check themselves monthly, to make sure they are and remain healthy. Today is your birthday. We celebrate you. We celebrate your Earth Day on this 6th day of March. We will remember that our body is our temple, that health is holistic, physical, mental, and spiritual. It's just that simple. Or is it? We know that sometimes life moves so fast that we don't take care or take time for ourselves, but we must. We must at every cost. So, I'm Pansy. Today is your birthday. We celebrate you. We celebrate your Earth Day on this 6th day of March. Go Pansy, it's your birthday. Thank you all for coming.